Test result stations in PLAB 2. Structure. Hello, my name is Dr. Surname. Could you please confirm your name and date of birth for me? I can see from my notes that you're here for a follow-up on your test results, or to discuss them today. Is that correct? Before I explain your test results, may I ask you a few questions, or would you prefer to know the results first? Could you tell me what prompted you to take the test initially? Remember to spend your time explaining the test results at the station. It includes taking a brief history and explaining the results, diagnosis, which is very important. Missing this part due to running out of time will result in a loss of marks. History refers to the symptoms, causes, risk factors, and complications associated with a diagnosis, test result. Differential diagnoses are not required here as the diagnosis is already established. Inquire about what led to his current test results. This information will assist you in managing the patient, and as patients may have concerns, it's beneficial to be informed in advance. Explain in detail. A diagnosis is the identification of an illness or problem by examining the symptoms. The consequences of the diagnosis and the symptoms being experienced depend on the specific condition identified. For accurate information, it's essential to consult a healthcare professional. Delivering bad news depends on the patient's expectations regarding their diagnosis. If a patient is already anticipating a diagnosis of HIV, cancer, or AIDS, it's not necessary to break the news gradually. You can begin directly. It's important to reassure the patient that with treatment, they can lead a normal life, especially if the diagnosis is AIDS. Let's discuss a few stations now. PCOD test result. Ms. And, a 28-year-old patient with complaints of acne and amenorrhea. History and examination. Chief complaints, acne and amenorrhea for 3 months. Pregnancy test, negative. Hormonal profile. LH, 18 mlu/ml, elevated. FSH, 6.5 mlu/ml, normal. BMI, 32, overweight. History taking. Menstrual history, period stopped 3 months ago, previously regular. Acne, present for 3 months, using emollients with some improvement. Weight gain, 2 stones in the last 3 months. Other symptoms, no pelvic pain, breast pain, nipple discharge, fever, flu-like symptoms, bowel problems, or excess hair growth. Mood, good-bad, depending on patient's response. Family history, sister with similar condition. Lifestyle, occasional wine, physically active, diet high in burgers and chips, stress at work. Examination. Vitals and general physical examination, normal. Assessment and plan. Diagnosis, suspected polycystic ovary syndrome, PCOS. Further investigations. Blood tests including cholesterol levels and thyroid function test. Ultrasound of ovaries to check for follicles. Management. Lifestyle modification and weight reduction. Referral to a dietitian for a diet plan. Possible medications for weight management. Referral to a specialist for further management. Medications to regularize periods, e.g., combined contraceptive pills. Prognosis, generally good with treatment. Complications, potential infertility and risk of developing diabetes mellitus. Follow-up, regular monitoring of hormone levels, blood pressure, and diabetes. B12 deficiency. Rosemary, A 40-year-old patient presenting with tiredness and low vitamin B12 levels. History and examination. Chief complaint: persistent tiredness for the past year. Previous treatment: given folic acid for low hemoglobin, but no improvement. Diet: vegan for the last 2 years. Other symptoms: no tingling, numbness, muscle weakness, mouth ulcers, vision problems, weight loss, loss of appetite, shortness of breath, heart racing, constipation, diarrhea, tummy pain, nausea, vomiting, or swelling in legs. Mood: fine. Concentration: able to concentrate on work. Family history: no significant medical conditions. Lifestyle: occasionally drinks alcohol, physically active. Examination. Vitals and general physical examination: normal. Assessment and plan. Diagnosis: vitamin B12 deficiency, possibly due to vegan diet. Further investigations. Additional blood tests to check for pernicious anemia. Management. Vitamin B12 injections, initially every other day for 2 weeks or until symptoms improve. Vitamin B12 tablets, daily between meals, or hydroxycobalamin injections twice a year for those on a vegan diet. Dietary advice include vitamin B12 fortified foods such as yeast extract, fortified breakfast cereals, and soy products. Follow-up. Blood test 10 to 14 days after starting treatment to check hemoglobin levels and reticulocytes. Another blood test after approximately 8 weeks to confirm treatment success. Patient education. Sources of vitamin B12: meat, salmon, cod, milk, dairy products, eggs, and fortified vegan options. Importance of monitoring: regular blood tests to ensure treatment effectiveness and adjust as necessary. Elderly woman with follow-up test results. History and examination. Chief complaint: follow-up for test results. Medical history. Hypothyroidism for 10 years, managed with levothyroxine 125 micrograms daily. Hypertension, previously managed with amlodipine 5 mg daily, not taken for the last 3 months. High cholesterol, managed with statin 20 mg daily. Symptoms: no visual disturbances, chest pain, change in bowel habits, heat intolerance, tummy pains, or headaches. Lifestyle: lives with daughter, does not smoke or drink. Examination. Vitals: blood pressure 160/95 mmHg. General physical examination: normal. Test results. Thyroid function: TSH, low. T3, T4, high. Blood pressure, elevated. Cholesterol, normal. Discussion and management plan. Thyroid management. Issue: thyroid is overactive, low TSH, high T3, T4. Plan: reduce levothyroxine dose to 100 micrograms daily. Patient concern: patient is reluctant to change the dose as she feels well. Action: explain the risks of excess thyroid hormones and involve senior doctors if needed. Hypertension management. Issue: blood pressure is high, patient has not taken amlodipine for 3 months. Plan: reinforce the importance of taking blood pressure medication regularly to avoid serious side effects. Action: encourage patient to resume amlodipine and monitor blood pressure. Referral. Specialist: refer to an endocrinologist for further management of thyroid issues. Follow-up. Arrange follow-up in 1 month. Advise patient to report any symptoms like blurry vision, chest pain, change in bowel habits, or headaches immediately. Osteoporosis. Joe Mater, a 65-year-old patient with a recent wrist fracture and a DEXA scan showing osteoporosis. History and examination. History and examination. Chief complaint, follow-up for test results after a wrist fracture 3 months ago. Medical history. Hypertension, managed with amlodipine. Surgery at age 35 to remove ovary and womb, early menopause. Family history of osteoporosis, mother and grandmother with hip fractures. Symptoms, no current pain or movement issues in the wrist. Lifestyle, lives with husband, good diet but low in dairy products, quite active, smoking and alcohol intake to be clarified. Examination. Vitals and general physical examination, normal. Test results. DEXA scan, shows osteoporosis. Discussion and management plan. Diagnosis, osteoporosis, a condition where bone density and quality are reduced, increasing fracture risk. Risk factors, family history, early menopause, low intake of dairy products, smoking, and alcohol intake. Management plan. Lifestyle modifications. Smoking cessation, referral to smoking cessation clinic for support. Alcohol intake, encourage moderation and offer support if needed. Dietary changes, increase intake of dairy products, oily fish, and nuts. Exercise, engage in weight-bearing exercises, walking, jogging, climbing stairs, and resistance training, using gym equipment under supervision. Medications. Vitamin D and calcium supplements, to support bone health. Bisphosphonates, to help strengthen bones and reduce fracture risk. Follow-up. Regular monitoring of bone density and overall health. Referral to a specialist if needed for further management. Please subscribe for more videos like this and feel free to ask if you need more details or have any specific questions.